Good evening, and thank you for joining us for a special edition of 6 News at 5. I'm Leslie Draffin.
Yeah, glad to be bringing you the show, everybody. I'm Chris Radcliffe, and today we will be answering your questions about COVID-19, the vaccines, and vaccination process. We'll be talking to representatives from Bell, Mclennan, and Coryell counties and their health districts, who will then guide us through what you need to know to get that vaccine, how to sign up, and other valuable information to help get all of us through this pandemic.
We'll also be speaking with registered nurse Christopher Brown, who has gotten the vaccine. He'll answer some of your questions about side effects and what to expect when you get the shot. First, though, let's begin with a look at vaccine distribution in our area. In Bell County, as of yesterday, 17,554 people had received at least one dose. 3,400 people have received both of those doses. Now, the numbers are slightly lower in Mclennan County, where 16,418 people have gotten one dose and just under 2,900 have gotten both doses. And as you would expect, Coryell County is quite a bit lower. They have 2,955 people who've received one dose of the vaccine and just 438 who have gotten fully vaccinated.
Meanwhile, Bell County serves as one of 28 COVID-19 vaccination hubs across Texas. Joining us now is Bell County Judge David Blackburn. And Judge Blackburn, first of all, thank you for joining us and for being here. We do appreciate your time this afternoon.
Thank you. Happy to be here.
Okay, great. I'm going to dive right in now and ask you some viewer questions. So here's the first one. I'm 80 years old with COPD and atrial fibrillation. I am also very computer illiterate, so I have not been successful at getting an appointment for the initial COVID shot. I've succeeded in getting my name into the pot for any residual at both Salmons and Killeen Civic Center, but it is unknown when, if I will be able to get this shot when it's available, or if I could get it in the allotted time. What should I do as an elderly, computer illiterate person?
All right, thank you for the question, and I'm not sure what she means by residual, but I'm going to assume that means the wait list, which we have instituted a wait list as of just a day or two ago. The wait list is fairly substantial at the moment, but I can also tell you that we're going through that wait list, literally hundreds of people per day as we work the vaccine centers. We have a fair number of no-shows and cancellations for a variety of reasons. And as we get those, then we go through and work that wait list. So even though the wait list may be, I think, in excess of about 15,000 right now, we are working through that wait list. And so I would advise this person, if she's already got on that wait list, that's a good start. We're working on the issue of folks that need help booking that first appointment. And the wait list is not a substitute for booking an appointment. It is a supplement to that. But we're going to work that issue for folks that are challenged with a computer or don't have a computer and have mobility issues. There's a variety of gaps that we're working very hard to try to bridge right now.
Okay, good answer. Hopefully that helped, Judge. I'm gonna pretend we're playing Monopoly now, and just for the generic public, this would be go. Please walk me through the process of signing up for and getting the vaccine in your county. Okay.
The first thing I would tell somebody to do is to go to www.bellcountyhealth.org. If you go to that website and then click on a link that says click here for information on the COVID-19 vaccine. Once you click on that link, if it is active, it will take you to a booking document where you can just fill in a few blanks and schedule an appointment. If it is not active, that means we don't have any current openings for the vaccine appointment at this time. Beginning next week, we will open up that appointment booking link at just after midnight on Tuesday morning, 12:01 a.m. Tuesday morning. And our plan is to open up that booking site every week at Tuesday morning, 12:01 a.m., and to fill appointments for that week. So that's the way you get the first dose here in Bell County, is to go to that link, that website, and then that link. And again, it will only open if we have available appointments. And again, those will be scheduled beginning on Tuesday. For second dose appointments, which we will be getting day after tomorrow here in Bell County, it's a similar process. You will go to the website and click on a link that says schedule a second dose. And again, there'll be a calendar there, a few blanks to fill in. You choose your appointment time. and you'll be scheduled.
Okay, Judge, thank you for your time. We appreciate it today. Sorry, we're out of time. We had a lot of great viewer questions. We're going to get back to you to get all those answered. And thanks for visiting with us today. We do appreciate you.
You're welcome.
All right, let's get things over to Leslie Draffin for more.
All right, so let's talk about vaccine distribution across our state. 6 News reporter Andrew Moore spoke with Van Dusen of the Department of State Health Services to get more information on our vaccine supply here in Texas.
How many doses is Texas getting from the federal government right now, and how do you expect to see that increase?
So over the last few weeks, we got about 330,000 first doses, and that's what I'm talking about here, first doses each week. We got a boost of about 50,000 Moderna doses for this current week that we're in. We expect that's going to continue. And then there was another 125 or so thousand on top of that, which was the doses we kind of got back from the federal long-term care program. So for this week, it's about 520,000 first doses. And then, there'll be another couple of 100,000 second doses for people who were vaccinated a few weeks ago. And
for counties that are giving this out, if they are, for example, getting a local health district is getting 1,500 doses every week for the last 4 weeks, do they have any guarantee that that's going to keep coming on a specific date so they can then schedule out appointments and make it easier for the public to say, yeah, you can have this Tuesday, next Tuesday?
So those providers that are designated as hub providers, and so that's like the Bell County Health Department, Waco Mclennan County Health Department, that's really one part of being a hub provider, is that we are, as long as they're, kind of meeting the hub requirements, which is, vaccinating large populations, prioritizing those that are the hardest hit, making sure they're using all those doses as they get them on a week in and week out basis, then they will continue to get a steady amount of vaccine. We've made that commitment to them that we will, continue to provide that amount of vaccine.
For those hub providers, can they expect their allotment to go up by any percentage in the couple of weeks, or they expected to see about the same amount for the next couple of weeks?
What we're expecting now is to keep those steady. Certainly if the overall amount of vaccine in the state goes up, we certainly could allocate more to those hub providers, but we also want to make sure we're reaching other providers too. So we're providing, for example, to federally qualified health centers and rural health clinics and community clinics that serve people who, are often underserved by the medical healthcare system.
Is there anything I didn't ask that you specifically really want to get out to the public?
And just really appreciate people's patience, particularly the people who aren't in those priority groups, and letting us vaccinate those folks first, and then standing by, and we'll let you know when it's your turn in line, and make sure that folks get vaccinated as quickly as possible.
And that was Andrew Moore reporting for us. You can read the full questions and answer session that we had with Van Dusen at kcentv.com. And you can continue to text the word vaccine right now to 254-859-5481 to stay up to date on the latest vaccine information in your area, wherever you live across our viewing area.
Welcome back to this special edition of 6 News at 5. Today we are focusing on your questions when it comes to the COVID-19 vaccine. Before the break, we talked to Judge David Blackburn with the Bell County Health District, and now we are heading to Mclennan County. Kelly Crane with the county's health district joins me now. Hey, Kelly.
Hi, Leslie. Thank you for having me on.
Thank you for coming. All right, let's take a few questions from viewers. Cindy Mitchell in Robinson asked, does Mclennan County have any program in place to guarantee a second vaccine for people who have already gotten the first?
Absolutely. If you've gotten your first shot through the health district, we will be contacting you to set up that next appointment. So our next round of second dosers actually starts next week. So within 28 days, you will receive contact from us through phone or email, and we'll schedule your second dose appointment. The state has done a great job. They're providing us, of course, with 1,500 doses every week. And starting next week, they're going to provide us with extra doses to get those second dosers out there.
Okay, and Kathy DeMaria asked, how does someone confirm that they are on the wait list in Mclennan County? Because we know y'all's wait list is long.
It is very long. Unfortunately, we don't really have a good system for confirming that. Of course, you can put yourself on, and once you put yourself on, you are on. Unfortunately, we have a waiting list of 20,000 people at least. So we go through, we verify emails and phone numbers, just make sure that you're on it. And as we work through this process, it's going to be slow. So we just ask for patience and persistence.
And you just mentioned that you guys get about 1,500 doses in those shipments. Will there ever be a time when you expect to be getting more doses?
Well, we hope so. You know, it all really depends on vaccine supply. The state has done a really great job at keeping their commitment to supplying us as a hub, and they're consistent about giving us the same amount of doses every week. It really will depend on supply. When they have more supply, they'll get it to us.
So talk me through how to sign up to get the vaccine in Mclennan County.
It's really easy. You have two ways of doing it. Of course, you can go to covidwaco.com and we have the waitlist button, and you just push that and fill it all the way through. Just make sure you get your email correct and your phone number correct, because we may contact you either way. If you're not comfortable with the computer, you can also call our call center at 254-750 1890, and that is our call center hub, and they can put you on the wait list as well.
Awesome. Is there a particular day or time of day someone should be either checking in with the website or trying to call that call number?
Absolutely. The website is 24 hours a day, but our call center is Monday through Friday, 8 to 5. So you can just call in and ask to be put on the wait list, and they'll give you that information and take it down and get you all set up.
And has there been any discussion of how to reach people who are in 1A or 1B who don't have transportation to the vaccine sites?
That is a concern. Always that is a concern, particularly when you're thinking about that 1B group. Right now, when we do call our 1500, we talk to them about ways that they can transportation if they have the appropriate transportation. Waco Transit also has programs for assistance for people with disability, so they can contact Waco Transit as well. The main thing is with 1500 doses, we just work with the people that we set up appointments to make sure that they're able to get there.
Okay. Well, Kelly Crane, thank you so much for taking the time to speak with us about this today.
All right, thank you.
We'll be right back right after this.
Welcome back, everyone, to this very special Monday edition of 6 News at 5, where we are getting you your vaccination questions answered. We're doing our best. Dr. Deidre Wenchel, the Coryell Health Medical Clinic Director, is now joining us with some pertinent information. First of all, Doctor, thank you for being here today.
Thank you for having me.
All right, terrific. Glad you are here. And I'm going to throw a viewer question that just came in at you right now off the top. Are all the shots FDA approved that we're getting, and how many people have died or contracted the virus as a result of taking this shot? If you could just knock that out for us right now.
Yes, both the Moderna and the Pfizer are FDA approved, and so far no one has died from getting the vaccine, and no one has contracted COVID from getting the vaccine. There are people who have been exposed to COVID prior to getting their vaccine and may not have tested positive until after receiving the vaccine, but they've not gotten COVID from the vaccine.
Well, thank you for clearing that up. I know there's a lot of confusion amongst the public. That's why we're doing this show today. And let me start by talking about Coryell County. We've already spoken to both Mclennan and Bell counties. How is your health district handling the distribution of the virus?
So we luckily have also become a hub in our town. And so we are receiving about 1,000 vaccines per week, and people are able to sign up on coryellhealth.org/vaccine and sign up for an appointment time when we have one available.
Terrific. And again, we will have that posted on our website, kcentv.com, if you missed that web address. Okay, do you find that you're having any challenges for maybe a smaller county and maybe even a more rural county than we see in Mclennan and Bell counties? Any special challenges you guys have been addressing for us in Coryell County?
Just like any other county, we do have people who have some difficulty using the internet, our own patients, and so we've been able to help them. All places have people who are unable to travel, so we have a place on our website where you're able to write notes if you have difficulty traveling, and so that we're able to tell you how we can help you during those ways, either via EMS or home health. We have different ways to help allocate the vaccines to those who need it.
Terrific. And I know for those who are successfully getting online, there's a lot of frustration when they see how long the list is or how many people that are in front of them. Is there a particular day or time that someone should actually check the website or go there? Is there any kind of advantage at all, or do you recommend just checking it constantly?
We recommend just checking it constantly because we don't want to put out there that we have vaccine if they have not come in yet. So we do not open up slots until we have the vaccine in hand.
All right. And people keep asking as well, when do they think the 1C vaccination list will come out, and exactly who do you expect to be in it at that point? We've heard a lot about 1B and 1A. What about 1C?
From what I've heard, it'll be later this summer. But if we can keep getting people shots, the faster we do, the faster we'll make it to those NCs.
Well, terrific. Thank you for joining us today, Dr. Deidre Winchell. We do appreciate it. I know you're working very hard. It's very busy on your end, and thanks for taking a few minutes out today to talk to our viewers. It is most helpful. Thank you for being here.
Thank you.
All right, and we will be back right after this. Stay with us. More interviews coming. We'll talk to a nurse.
Welcome back. Thank you again for joining us on this vaccine special of 6 News at 5. Joining me now is registered nurse Christopher M. Brown. Thank you so much for joining me.
Good evening. Glad to be here.
So we know you have received the vaccine. Can you talk me through some of the possible side effects people have seen, and did you have any?
Well, side effects include flu-like symptoms, a mild fever, headache, muscle aches, nothing too out of the ordinary. I didn't really have any side effects. I felt a little lightheaded shortly afterwards, slept it off, no problem. Of course, my arm was a little tender, but that didn't last long. I was kind of glad my arm was tender because it let me know that something was working, that I actually got a vaccine.
Absolutely. And can people still contract or spread the virus after they have gotten their vaccine, after they've gotten the first dose or after they've gotten both doses?
So, yes. I mean, I had a friend who tested positive for the COVID the day after the vaccine, but that was probably because she came in contact with it before she was actually vaccinated. Now, after the first dose, it takes a while for you to build antibodies, and during that period of time, you can still become infected. And even when you build antibodies, it doesn't necessarily mean you won't catch COVID. What it will mean is your body has a chance to fight it, and you have a lot greater opportunity to resist it, and your symptoms won't nearly be as bad as somebody who is not vaccinated.
Right. Now, if you have the first dose and say you get Pfizer, could you get the second dose of Moderna, or do you have to do both doses with the same brand?
It is highly recommended that you stay with the same brand. I just heard a broadcast a few days ago saying that if you were to accidentally get the wrong brand, you would be okay. If there was no other choice, you would be okay. But you should really stick to the same brand. So make sure you get the vaccine card that shows you exactly what you got, so you can present that, and they know which vaccine that you're getting.
Now, will this vaccine be something we need to get seasonally, like a flu vaccine?
They're not entirely sure about that yet. There hasn't been, of course, the studies are new. They know that the vaccine works. They know that the vaccine greatly reduces your chance of getting it. And no one who was in the studies was hospitalized even when they became infected. But whether or not you'll need a booster a few years from now is not known.
And what about if you get COVID, or if you had COVID? How long should you wait to get the vaccine? Should you still get the vaccine if you've already had coronavirus?
So if you become infected with the coronavirus, there is no recommended mental interval between infection and vaccination, but you should absolutely wait till your isolation and quarantine period is over. Now, if you were treated with the monoclonal antibodies, you should absolutely wait 90 days before getting the vaccine.
And when are we going to know if these vaccines work?
Well, we know they work. We already know they work. The studies have proven that they work. We're talking up to 90% effective 95% effective if you get both vaccines, depending on your age group. Some of the other studies have shown 60%, but the ones that have released and approved in America, the Pfizer and Moderna, are highly effective in either preventing or greatly reducing the chances of you having severe disease. How long they will last, how long they will maintain the antibodies is still not clear.
All right. Thank you so much, Nurse Brown, for chatting with us today, and we really appreciate you taking the time.
My pleasure.
All right.
My pleasure.
And don't forget, all of this information will be for you on our website today at kcentv.com. You can also check out our YouTube channel, and you can continue to text us any of your questions along with the word vaccine to 254-859-5481. We'll help you stay up to date on all the latest information in your area.